Hi, everybody. It's Yvonne DeVita and Dr. Larry McDaniel with another episode of Scratchins and Sniffins Out Loud. And today we're really excited because we have a treat for you. A reader wrote in, Virginia Tan. She's a high school student. She asked about a day in the life of a vet because she's thinking about becoming a veterinarian. And, of course, we applaud that idea. We think she should pursue that. Being a veterinarian is a great career choice. Because she wrote in, Dr. Larry wrote to me and said he had a friend, and his friend would be willing to talk about a day in the life. And he's going to introduce Dr. Bill Craig, and Dr. Larry and Dr. Craig are going to talk about a day in the life. I'm going to turn it over to you, Dr. Larry.
Okay, thanks a lot, Yvonne. And Yvonne's right. We're very lucky to have Dr. Bill Craig, who is a practitioner from the San Antonio, Texas area. And Dr. Craig and I have gotten to know each other over the last few months because we're involved in another business venture that we will talk about shortly on the blog. But I wanted to involve Bill in this discussion for a couple of reasons. First of all, he was an exclusive small animal practitioner. And I think that that's probably what Virginia was interested in. And Bill ran a very successful small animal practice in San Antonio, the Ingram Park Animal Hospital. And another reason I wanted to get Bill involved is that he's a board-certified practitioner. He belongs to the American Board of Veterinary Practitioners, which is a specialty group. And so, Bill is probably one of the top small animal veterinarians in the country, and I think we're just very fortunate to have his expertise. So, Bill, I know when I was in practice, and the mornings could be kind of hectic. We had cases that were there from the night before. We had people dropping animals off in the morning. We had surgery to do. Can you give us a little bit of an idea about how you triaged the mornings at your hospital?
Sure, Larry, and thanks for letting me have the opportunity to come on the Scratching and Sniffing blog. The mornings, while you always try to have some structure and organization, as you mentioned, have a tendency to fall apart and be kind of hectic. So it's important to have some basic organizational structure so that you can always try to get back on track. I would always, first thing in the morning, try to set up in my mind, a little bit of organization on how we're going to approach the day, looking at different categories of patients that needed to be seen and the priority or urgency in which they needed to be treated. One group that you mentioned were hospitalized patients that had been there overnight. We would need to reevaluate their condition and make a treatment plan for the day. Another high priority group would be patients that had been transferred from the emergency clinic by their owners, where they'd been treated at the emergency clinic overnight, and then were transferred to our hospital for continuing care during the day. Those patients oftentimes might have been in a critical condition and need to have closer attention. We'd also have patients that were dropped off by their owners on the way to work, maybe for routine care or maybe for minor issues that needed to be addressed. We'd have patients that were admitted for surgery or other anesthetic procedures during the day. And, of course, we had our regular scheduled appointments, outpatient appointments to be seen. And then the thing that always throws a kink in the system, and that's walk-in patients that you didn't anticipate showing up, or emergencies that come in the front door unannounced. So there's a whole group of different categories that need to be addressed there.
So, Bill, you had another veterinarian working with you, correct?
Yes, it was a two-doctor practice. And we would divide up the workload. We would have some patients that were, I guess, would be considered my patients or his patients, where the client preferred one doctor over the other. There were some that weren't that particular, and we would try to divide the workload relatively equally. If there were ongoing cases, for example, hospitalized cases or patients that were being seen for follow-up, then obviously one particular doctor would be responsible for those cases. Also, obviously, if we're in surgery, that's an activity that requires your total attention, and you're not able to take care of other patients. So we would schedule one of us or the other on certain days to have surgery, and then the other doctor would be seeing patients.
Okay. And did you have a full complement of technicians and assistants helping you?
Yes, and that's a very important part of efficiently operating a busy practice. It's impossible for the doctor to do every specific thing that needs to be done, and leveraging your time through well-trained and qualified veterinary technicians and assistants is just imperative for successful operation.
Right, I can imagine. So a lot of the routine treatments for hospitalized pets, those would be done in many cases by the technicians.
Exactly, and I would make an analogy to a human hospital. The doctor comes in and examines the patient and then writes out treatment orders, and that's turned over to nurses and other technical staff to actually perform those treatments. So the doctor is managing the case and directing the treatment, but much of the hands-on patient care is often done by technicians and veterinary assistants.
So while one of you was doing surgery in the morning, the other might be seeing patients that had appointments.
Right, or treating hospitalized patients, or seeing the drop-offs and the other groups of patients that need to be seen. So one person probably would be spending the morning doing surgery, the other seeing other categories of patients.
Can I ask a question here, Bill?
Sure.
For two veterinarian practice, how many technicians did you have?
Usually 1.5 to 2 technicians per doctor, and then maybe a couple of extra what we would call assistants that maybe weren't as well trained or as experienced as the technicians that would help the technicians. Dealing with animal patients is not quite the same as dealing with human patients because they're not always cooperative in the treatment process, and so sometimes you need an extra person, an extra pair of hands just to help with restraint and facilitate the process. So the veterinary technician could be much more efficient in their time if they had one that was helping them with the treatments.
Okay. Are we done for today?
I think so. I'd like to thank Bill for taking time out of his day to visit with us, and hopefully we can have you on as a regular contributor in the future.
Be glad to.
Thank you both. I appreciate it. I hope Virginia got the information she needs, and I hope anyone listening has any questions will write in, and we'll be happy to have either Dr. Larry or Dr. Bill back on to answer those questions. So this is another episode of Scratchins and Sniffins Out Loud.